PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Sham Dallas. In today's show, Phaedra, we're going to be looking at the health issue of HIV/AIDS and bringing you one innovative way this is being addressed right here in our own community.
And you know, Sham, I think HIV/AIDS is one of those health topics where people think it's not a problem anymore, but that's just not the case. It's still a very important health issue that we need to face.
Well, one of the ways it's being addressed is a partnership between the College of Public Health and AIDS Athens. They've joined forces to bring awareness of HIV/AIDS right here in our own backyard.
And I'll be talking to representatives from both of those organizations, and they're going to give us some of the details of their collaboration and tell us what they've been able to accomplish.
Well, the latest figures from the Centers for Disease Control and Prevention is that over 1 million Americans are now infected. And even worse, if it's possibly worse than that, is that 20% of them don't even know they're infected.
Yeah, and here in Georgia, we're not doing very well at all. I think we rank the 6th highest number of cumulative AIDS cases in the country.
Well, joining us today to be part of the solution are Olivia Long, the director of AIDS Athens, Mumbi Okundaye, the faculty member of AIDS Walk, and MPH student Barbara Gaston, who's a participant in AIDS Walk Athens.
So stay with us as we talk about AIDS, HIV, here on PHI, Public Health Impact. With me now is Olivia Long, who's the Executive Director of AIDS Athens. Thank you so much for joining us today, Olivia. For clarification for our audience, let's just get a definition here of AIDS and HIV and how are they different or the same?
Okay, so HIV is the virus that progresses to AIDS. AIDS is acquired immune deficiency syndrome. And the progression between HIV and AIDS is called actually HIV disease.
Okay, and so when you talk about viral load, you're really talking about the HIV stage, and I assume then the lower your load, the less the disease is?
Yeah, so the way it works is the viral load that a client has is how much virus they have in their system, in their blood. And you want a lower viral load, and when you have a lower viral load, your T cells or your CD4 cells should increase. So you have a better immune system when your virus is lower. And so the goal of medication is to keep that virus low, so to keep it from replicating in the system. HIV meds, there's actually 30 different HIV meds, and they all do different things. So they keep the virus from binding to an immune cell. If it gets through that part, it keeps it from replicating in the cell. And if you have a virus that maybe can get past that side of the system, then it keeps it from exiting the cell, so the new HIV virus, and infecting another. So HIV meds kind of work to almost help your body stop at all parts of the replication process to keep the virus down.
And then Olivia, once you're diagnosed with AIDS, can you go back to the HIV status, or is that
No, what will happen is you'll always have that HIV, and it's really a definition. You know, it's a definition of where your body got to a certain point. You know, you had an opportunistic infection, your CD4 cells got really low, so it's a definition. So you always will be you will always have AIDS, but your body can rebound in order, like CD4 cells come up, viral load goes down, but you still keep the same definition of AIDS because your body has the potential, not on meds, to get there.
Okay. Before we start talking about the walk, the AIDS Athens walk, I'd like to hear from you about the prevalence of AIDS in our community.
Okay. Well, the data is pretty old. The last data we have is from 2009. We serve as AIDS Athens Northeast Georgia, which is the 10 counties. So the data is from there, and it's about 1,000 people are infected in the area. Now that's a pretty underestimated number. Those are the people who we know that are positive. They've been to a physician. It's been reported to the CDC. The data is collected, but there's a lot of people who have tested anonymously, have tested positive, might not gone to a physician. Also, something that kind of skews the data is at the beginning of the disease, you only had to report AIDS cases. So you only had to start reporting cases of HIV on December 31st, 2005. So we have a lot of people that we that we know are positive, but it hasn't been, reported. We also just have a lot of people who are infected but don't know that they are because they haven't gotten tested. So we really aren't really sure about how many people are infected in the area.
So a minimum of 1,000, but probably much more than that.
Yeah, probably much more than that.
And you said Northeast Georgia, so you're not just talking about Athens, Clark County. What area does Northeast Georgia encompass?
So it's 10 counties. We serve Walton and Barrow, Greene, Oglethorpe, Oconee, just the 10 counties, the same that the Clark County Health Department serves.
Okay, and a minimum of 1,000 sounds very high to me, but how does that compare, at least across the state or nationally?
So it compares across the state, okay, but what's interesting about our country is that the southern states are more impacted by the epidemic than the United States. The southern states have more HIV cases, new diagnoses. The rate that clients progress from HIV to AIDS is much faster. AIDS-related deaths are more in the South compared to the rest of the country.
And why is that?
Well, there's a lot of theories on why that is. A lot of it could be because of lack of education in the South about sex education in schools. You know, we're not as open in the South about talking about sex with our kids. It's also the epidemic is really affecting African Americans a lot, and we have a lot more African Americans in the South. We also have more poverty in the South. There's also, with how funding is distributed, there's a lot less funding for HIV and AIDS and HIV and AIDS prevention than there are to metropolitan cities like LA and New York. We have a lot less funding coming to the South. But it's interesting, there's a great document put out by the Alabama AIDS Coalition called the Southern States Manifesto, and you can Google it, but it talks about the huge impact that AIDS has had on the South, and compares that to the funding that we've received. But some of the stats from there are that 16 of the 20 highest metropolitan cities for new HIV diagnoses and AIDS-related illnesses are in the South. So we have 16 of the largest cities in the South, but less money coming here for HIV and AIDS prevention or care.
All right, so one thing that you mentioned I want to ask for more clarification. You said that we have, here in the South, that our HIV cases progress to AIDS at a faster rate. Why is that?
Some of it's just lack of getting into care. So some of the experiences we've had at AIDS Athens is a lot of the primary care physicians in the rural areas aren't up to date on HIV and AIDS. So they don't know to test someone for HIV when they have risk factors for it. People aren't as honest about those risk factors with their physician, so they're getting into care a lot later in the disease.
That must be increasing the mortality rate too, I would guess.
It is. And then also we've had clients come into our office who have gotten a diagnosis by their physician, but their physician did not know what to do. So they come into care at AIDS Athens, we hook them up with the local HIV clinic to where they can get on meds. But sometimes people are diagnosed and literally have no care related to their HIV because their doctor just really isn't sure what to do. And there's just a lot more rural areas in the South that happens in.
Right. So let me transition my line of questioning now into the organization itself, AIDS Athens. How long has your organization been around?
This is our 25th year of service.
Wow. And what is the purpose of your organization?
So our purpose is to serve the needs of people who are infected by HIV and AIDS. So that's case management, housing, financial assistance, clothing, medical needs, and also to prevent the spread of the disease in our community. So
is your role as an organization to hook them up to the right resources, or do you actually have the resources?
Most of those services we provide in-house.
And where does your funding come from?
Our funding comes from a variety of different sources. Of course, donations from the community. We also get a lot of federal funding for housing. People with HIV and AIDS, it takes such a toll on their body that they are at risk of homelessness far more than any population of people. And then people with HIV and AIDS also sometimes have co-occurring disorders like substance abuse and mental health, which probably led to their contracting the virus. So when you have someone who has HIV and AIDS, substance abuse and mental health, if they're not already homeless, they're at increased risk for homelessness. So there's a lot of funding that comes to AIDS Athens for housing. And with housing, you know, when I have a master's in public health, so when I got into AIDS Athens, I thought I would be doing more prevention, and I thought, you know, housing, you know, but really housing is prevention. And it's prevention in the sense of we're getting people off the streets into care. When people are housed, they're more likely to take their medication. They're more likely to get treatment for their substance abuse and mental health because they're not trying to figure out how to get a place to live, yeah, and where to sleep that night, and what they have to do to sleep somewhere that night. So they're also, when they take their meds, they're reducing their viral load in their body. So if they practice unsafe sex or needle sharing, the likelihood of them spreading the virus to another person if they're on meds is greatly reduced.
So it's like you're dealing with the basic needs of survival.
Yeah, and the basic needs of survival protects not only our client and their quality of life, but also the community as well. So housing is a huge part of what we do as an agency.
With the economic downturn, have you seen federal funding, your federal funding decrease over time?
We have, like, across the board it has. For the housing grant for people with AIDS, it's called Housing Opportunities for Persons with AIDS. And it's decreased nationally. But AIDS Athens is somewhat blessed in the sense of we're the only AIDS service organization serving our area. So our funding hasn't been decreased for our area, and we're seeing a lot more clients coming into our building, so our funding's been going up based on the number of clients that we're seeing. We see about 6 new clients a month, actually.
Wow. So Olivia, you mentioned you have a master's degree in public health, and we've done shows in the past and we'll continue to do shows on public health careers. Can you tell me a little bit about how you became involved in this organization and kind of what was your, what's your pathway to do the type of work you're doing?
So I started out interning at the CDC working on the hantavirus. That's what I did. And I did a lot of what I would consider back office kind of public health for a while, like a lot of data, a lot of research. And then I went into, my focus in my public health training was health education. So then I went into doing, I guess, what I consider kind of cutesy public health. I was doing a lot of stuff for Children's Healthcare of Atlanta, car seat safety, bike helmets, like keeping preventable injuries out of the emergency room. And I really enjoyed that, but I really didn't feel like I was doing real public health work. And a lot of my training was on grant writing and fundraising and just financial management, which is my back office kind of public health work, which I love so much. So a position came open as the executive director of AIDS Athens, and I had not run a nonprofit organization before. It was something completely new to me. I just run programs, and did budgets for those programs and financial management for those programs. But I really felt like I could do this. I really felt like I could run an organization.
So the skills required to be an executive director of a nonprofit would include things like
budget planning, financial management, working with a board of directors, program development, evaluation. But the biggest thing with a lot of nonprofits is just you have pennies that you have to make dollars. So just financial management is something that's really key to running a nonprofit organization. And I can tell you when I felt like I got sort of tricked into the job, because when I got interviewed, it was this great song and dance about AIDS Athens. And when I started on my first day, we had $55.82 in the bank account.
Oh, yeah.
So, it was an organization that was really struggling, but today we have over $1 million annual budget. So we're doing really well.
We're going to turn our attention to the AIDS Athens Walk and talk to a few folks about that, and we'll be back with Olivia in a few minutes. With me now is Mumbi Okundaye, who is the coordinator of the MPH DRPH program in the College of Public Health, and she's also the faculty mentor in the Athens AIDS Walk. Welcome, Mumbi.
Thank you.
So why don't you start off by telling us about how you came to be involved in the Athens AIDS Walk?
Well, I am currently a board member of AIDS Athens, and as a board member, one of the major things that we do is try to raise money for the organization. And so the AIDS Walk had previously happened at the College of Public Health, and so I opted to reinitiate the AIDS Walk as a board member.
Okay, and what is the purpose of the walk?
It is to, one, raise money, of course, but also to raise awareness of intervention and prevention efforts in HIV and AIDS in our community.
So why don't you tell us a little bit about the experiences of organizing the walk, because I think there's many people in the community who would like to be involved in something like this, but they just don't know what it takes.
Right. Well, the first thing that you have to do is hit the ground running with no fear. There's all sorts of resources that you can utilize. Websites, of course, are the main thing right now, and so we utilized eTapestry for registration. We had a booklet that had information on how to do walks and, from A to Z what you can do to sponsor a walk. And so we just used the resources that were out there, and we started with absolutely no trepidation and just put it on.
All right, and tell us a little about the walk itself. How many people were involved, and maybe even, if you could tell us a little bit about how much money you were able to raise in the process.
Well, it's actually kind of a funny story because up until about 2 weeks before the walk, we had about 30 people registered for the walk, and it was very scary to know that 2 weeks from now
and nobody comes.
And nobody comes, exactly. But we really picked up with advertising and getting the word out. We were on the radio, we were on TV, we were, you know, in the local paper, and between those 2 weeks, we picked up about 150 people. So at the walk, it was way more successful than we had anticipated.
So what about next year? Does the college plan to be involved in the AIDS Walk Athens next year?
Absolutely.
And is there a date set yet for that?
Yes. The general time that we try to have it every year is during National Public Health Week. And so to either begin it or to end it. And this next year, hopefully, we'll be ending it at the end of that Saturday of National Public Health Week.
Which is what?
April 6th.
Okay, and for those in the community who might like to get involved in something like this, what would they do?
Well, our University of Georgia College of Public Health has a website, and our calendar is always up to date with the events that we have planned. So the walk will be on the calendar, and there will be a link to my direct email, so anyone who is interested in volunteering or more information can contact me directly.
Okay, great. Thanks so much for joining us.
You're welcome.
With us now is Barbara Gaston. She is an MPH student here in the College of Public Health, and thank you so much for joining us, Barbara. I know this is your second or third time on the show, so we really appreciate it.
Thank you.
So you're with us today because you participated in the AIDS Athens Walk, and I guess I just wanted to first ask, why did you do that, and what got you interested in the walk in the first place?
Sure. Well, I'm a member of our Graduate Student Association, the Public Health Association at UGA, our executive team. So as a member of that, I decided to get involved with some of the philanthropy things that our philanthropy chairs were getting together in the college. So I was excited to get involved.
All right, so tell me a little bit about the Student Association, because I think this is a nice example of how our students, our public health students, are getting involved in the community, and this is one example. What are some of the other philanthropy type things that the Student Association has done this year?
Well, our two main initiatives this year were the AIDS Athens Walk, as well as the University of Georgia Relay for Life, which is something that we're involved with every year. To build up to those events and to raise money for those events, we had lots of different things throughout the course of this year. Fundraisers, percentage nights at different restaurants around town. The Athens community is generally very receptive to student groups trying to raise money for philanthropies. We had our annual chili cook-off for our faculty and students, and several other things over the course of the semester.
And how many students are involved in the association?
Well, we have our executive committee, which consists of president, vice president, treasurer, secretary, philanthropy, and social. And we have monthly meetings, and students from all around the college come and attend the meetings. We usually have 30 to sometimes more students. We bring in guest speakers sometimes to talk about different needs in the community or different job opportunities, things like that.
So we're going to talk about the AIDS Athens Walk in a minute, but let me just ask you about Relay for Life. What event is that, and what is the purpose of that event?
Well, Relay for Life is through the American Cancer Society. It's one of their major fundraisers they do every year to raise awareness and raise money for cancer research. And the University of Georgia actually has the largest Relay for Life of any college in the country. So it's a really, really fun event. I've been going all throughout undergrad and grad school. And it's a fun time, but there's also serious times to focus on the survivors and people who are caregivers for people dealing with cancer.
And what time of year is Relay for Life?
It's every year towards the end of spring semester, and it's held out at the UGA intramural fields, and it's a huge party. It's really fun.
All right, well, let's talk about the AIDS Walk now. How many of our students were engaged in the walk? Do you have a sense of that?
I'm not exactly sure about a count for our college. I know a lot of people did get involved, and all of our officers from our executive team got involved, and they ended up having a really good turnout. It was a really fun experience.
And how about any faculty? Did we have any faculty that participated?
A few, and Mumbi, who spoke earlier, was the main staff person who was getting everyone excited and trying to get people registered.
All right, Barbara, I want to ask, what are your plans for the future?
Well, I am in the Health Policy and Management Department, and I've had more of a focus on policy. And I have been job searching and communicating with some different contacts that I have, but I would like to work on the policy side as a policy analyst or in some type of public health lobbying or advocacy.
I think you're a great example of a student who's become engaged in community level service from the very beginning. Do you plan to continue doing that when you go out into the big world and have a job in the future?
Oh, definitely. Community service, ever since I was really in elementary school, middle school, has been a big part of my life, and my parents have encouraged that. But in undergraduate, during my undergraduate years, I was a member of a community service sorority, and that's something I definitely am going to take into the rest of my adult life, because it's so important to give back to your community and pay attention to the issues that are relevant.
Well, thank you so much for your service, and thank you for joining us today.
Thank you.
So Olivia, we've talked to Mumbi, who was involved from the College of Public Health in the AIDS Athens walk, and we talked to Barbara, a student. From your perspective as the executive director, what is the purpose behind the walk?
I think the walk, to me, is the biggest thing we can do to spread awareness of the disease, that it's still impacting our community, but also for me, it's a great public display of a connection to a population of people who still feel very much discriminated by the community, who very much are discriminated by the community, and also have a lot of self-induced stigma. Our clients really struggle with how they became infected. They also struggle with discrimination. We have landlords all the time that don't want to house our clients. We had I won't tell you the name, but we had a shelter in town a couple of years ago that wouldn't take people who were HIV positive. So stigma's still out there and discrimination's still out there, and then the self-induced stigma that our clients feel. So it's really amazing and really helps their self-esteem to see so many people walking for their cause and walking to support their struggles in the disease, and not just what it does to your body, but just what it does to your sense of self.
Sure. And so I know College of Public Health was one of your partners. Did you have other community partners to help you with the event?
I think just the students at UGA. We had a couple of interns at the office that helped with the event. We also, there's a great foundation in town called the Boy Bhutan AIDS Foundation that did the water station for the walk, and everything from Starbucks having the coffee in the morning for the walkers. I mean, it was great. It was a big community event.
So tell me about the students. How many students did you have involved?
We had I would say most of our walkers were students, and I think that's really great because if people don't know, 10% of our client population at AIDS Athens are students from the surrounding colleges, so from UGA and Piedmont and Athens Tech and Gainesville College. So I think for students, knowing that there's someone in the classroom that's possibly struggling with this disease it is very important to come out and show your support, because they're also struggling with the stigma related to it.
So how often should people be tested?
I mean, you should be tested anytime you're sexually active, anytime you're, if you haven't been tested before, get tested. If to get routinely tested, it really just depends on the risk factors that you have for the disease. So how, sex, unprotected sex, needle sharing, it's hard to tell, say, when someone should get tested, but if you've had a risky encounter, get tested. We have testing in our office. We have 20-minute testing, so you get your results in 20 minutes, because sometimes I know it's stressful to wait 3 and 5 days for a test result to come back, so we do have 20-minute testing in our office.
So for people in the community who want to get involved in this very important public health issue, other than the AIDS Athens Walk, are there other opportunities for community members to get involved? Sure.
I mean, we have volunteers at our office every day. We need volunteers at the front desk. We need volunteers at our client events. We need peer counselors. So if you're HIV positive and you're living really independently and well with the disease, what we say is like positively living, we need peer counselors in order to support clients who aren't doing so well, so especially our newly diagnosed clients that are really struggling that. So we kind of match positive people up with positive people. And we also have a buddy program where people who are negative, who just want to support someone who's positive in the sense of helping them do anything that's not related to HIV. So going to the movies or out to dinner, or just talking on the phone, but getting their mind distracted off the daily struggles with HIV. But there's volunteering in the office, there's volunteering at events. Obviously donations are really important. They really support our organization, and we always are looking for people to become board members at AIDS Athens.
Well, great. Thank you so much for joining us today.
Thank you.
Thank you all for joining us. We hope that today's show motivated you to become actively involved in your community. You know, Phaedra, it's never too early or too late to start making a difference.
Yeah, Cham, our students show that, and with their involvement in the community, taking care of this very important public health issue.
And we'd also like to thank them for all they do as they try to mitigate the impact of HIV/AIDS, not only in our community, but throughout the state.
So thank you so much for joining us as well, and we'll see you next time on PHI Public Health Impact.